Hello everyone, I'm Dr. Vanessa Goh and I've been practicing medicine here in Singapore for over 20 years already. Today I want to talk about something that many men experience but few want to discuss openly. You know what? In my 2 decades of practice, I've seen countless men walk into my clinic at Mount Elizabeth, sit down and struggle to even bring up this topic. But let me tell you something lah, if you're experiencing difficulties getting or maintaining an erection, you're definitely not alone. This happens more often than you think. In fact, studies show that more than half of Singaporean men over 50 have experienced this at some point. So if this has happened to you, whether it's once or more frequently, I want you to know that there's no need to feel ashamed or embarrassed about it. This is a medical matter, not a personal failure. Before we continue, please subscribe to my channel and give this video a like. I share many videos with advice and tips about health, relationships, and wellness, especially for people over 50. I want all of you to enjoy a fulfilling life full of love and joy, okay? Now, let me start by saying something very important. I've been treating patients for more than 20 years, and one thing I've learned is this: your masculinity is not defined by your ability to maintain an erection. Let me repeat that again because it's crucial. Being a man is not about whether your penis can perform on command every single time. That's only one small part of your sexuality, not everything. Think about it this way lah. Imagine your sex life is like a car. This car has many different parts: the engine, the tires, the steering wheel, the seats, the radio, and so on. Now, if one tire goes flat, does that mean the whole car is useless? Of course not, right? You change the tire and continue driving. Same thing with your sexuality. If one aspect isn't working perfectly on a particular day, it doesn't mean everything is spoiled. You might not be able to get an erection for many different reasons. Maybe you're tired after a long day at work. Maybe you're stressed about your boss giving you problems. Maybe you ate too much at that hawker center for dinner. You know how it is. Sometimes the char kway teow is too shock and we eat until too full already. All these factors can affect your sexual performance, but none of these factors have anything to do with your worth as a man. And here's something else I want you to understand. Sexual satisfaction doesn't depend only on penetration. There are many other ways to give and receive pleasure. Things like oral sex, kissing, touching, all these are important too. Actually, let me share a secret with you based on my years of practice and talking to couples. Most women don't see the lack of an erection as a big problem as long as you're with them and they feel connected to you emotionally. Often, it's our own insecurities that make the problem seem bigger than it really is. Women value intimacy, emotional connection, and pleasure in other forms much more than just one type of physical act. Now, I know what some of you might be thinking. Dr. Goh, easy for you to say lah, but when the moment comes and nothing happens down there, I feel like dying already. I get it, I really do. But let me tell you something from my experience treating hundreds of men with this condition. Imagine you're at a party and suddenly you trip and fall down. If you feel embarrassed and try to hide, everyone will notice and it becomes awkward, right? But if you handle the situation with grace, laugh it off, and the party continues, the story might even become a funny memory later. Sex is the same way. When you can't get an erection, it might seem like a disaster, but you can handle this calmly and naturally. So what should you do in that moment? The first thing is to stay calm. I cannot stress this enough. Anxiety will only make the situation worse and more complicated. Don't let the stress of the moment take over. Take a deep breath. Your reaction to any situation can make all the difference. Don't try to force an erection. That's like trying to force yourself to fall asleep when you have insomnia. The more you try, the harder it becomes. Instead, take your time to create a relaxed and comfortable atmosphere. Rather than focusing on penetration, focus on maintaining the connection with your partner. When you stay calm, you can create a pleasant and trusting atmosphere. This is so important for maintaining your relationship with your partner. If you try to hide the problem or become anxious, it can create a lot of tension. It's better to be honest, but in a light-hearted way. For example, you could say something like, wow, today seems like I'm having some technical difficulties lah, but let's enjoy our time together. In other ways, this kind of humor can reduce pressure and create a more relaxed atmosphere. Communication is key, you know what I mean? Now, I want to talk about something that many doctors don't spend enough time explaining. Many of you think that when this happens, you just have to accept it and work around it. But that's not entirely true. There are actual medical solutions available, and I think it's important for all of you to know about them. First, let me explain the common causes. Sometimes it's just temporary. You're tired, stressed, or you ate too much. That's normal and nothing to worry about. But if you're experiencing this problem regularly for more than 3 months, it might be related to underlying health conditions. Things like diabetes, high blood pressure, high cholesterol, all very common among Singaporean men, especially those of you who've been eating nasi lemak and kaya toast every morning for years, right? The good news is that there are many treatment options available. Let me run through them with you. First, lifestyle changes. I know everyone tells you to exercise more, eat better, lose weight, but I'm serious lah. These things really work. Regular exercise improves blood flow, and better blood flow means better erections. Even just walking around your HDB estate for 30 minutes a day can make a difference. Cut down on smoking and alcohol also helps a lot. Second, there's a type of exercise specifically for men called Kegel Exercises. These strengthen your pelvic floor muscles. Many people think Kegel exercises are only for women after giving birth, but men can benefit too. The technique is simple. You squeeze the muscles you use to stop urinating midstream. Hold for 5 seconds, release. Repeat 10 times. Do this 3 times a day. After a few weeks, many of my patients report significant improvement. Third, medication. Yes, there are pills that can help. I'm sure you've heard of them. They've been around for more than 20 years now. These medications work by increasing blood flow to your penis. They're very effective for most men, but you need to get them prescribed by a doctor lah. Don't just buy from those suspicious websites, okay? The doctor needs to check if you have any health conditions that make these medications unsafe for you. Fourth, for some men, testosterone replacement therapy might be helpful if your testosterone levels are low. We can test this with a simple blood test. And for those who don't respond to pills, there are other options like injection therapy or even devices. I won't go into too much detail here, but the point is there are solutions available at any age. This is especially important for those of you who might be thinking, yeah, I'm already 60 plus, 70 plus, it's too late for me already. No lah, it's never too late. I've had patients in their 70s who came to me thinking their sex life was over, and after proper treatment, they reported significant improvements. Your age doesn't mean you have to give up on this aspect of your life, but for today's video, I also want to focus on what you can do in the moment when an erection isn't happening, because even with treatment, there might be times when it doesn't work perfectly, and that's okay. Let's talk about alternatives. When your penis isn't cooperating, there are many other ways to ensure both you and your partner enjoy intimate moments together. Think of it like this: if the main dish isn't available, there are many delicious side dishes to enjoy, right? Oral sex is a wonderful alternative. With this type of stimulation, you use your tongue and mouth to give your partner pleasure. For many women, oral sex can lead to orgasm, and the experience can be very intense and satisfying. Every woman responds differently to different techniques, so it's important to pay attention to her body's signals. Start with slow, gentle touches, explore different areas with your tongue and observe her reactions. Don't worry about following some script from those movies or what you read online. What matters is that you pay attention to her responses and adjust your techniques accordingly. If she seems to enjoy a particular type of touch, continue with that. Using your hands is another excellent option. Manual stimulation of the G-spot and clitoris can be very pleasurable. The clitoris, when stimulated properly, can trigger intense orgasms. Gently explore the G-spot with your fingers. It's located inside the vagina. Pay attention to her reactions and adjust your touch based on what she enjoys. The key here is communication, but not necessarily verbal communication all the time. Sometimes you can tell from her body language, her breathing, the sounds she makes. If she's relaxed and satisfied, you're doing well. If she moves or makes a new sound, that might be a signal to adjust what you're doing. You know what I've learned from my patients over the years? Many couples actually discover new forms of intimacy when they are forced to explore beyond penetrative sex. Some of my patients have told me that their relationships became even more intimate and satisfying because they learned to communicate better and pay more attention to each other's needs. Let me share a real story with you. I had a patient, let's call him Mr. Tan, who came to my clinic about 5 years ago. He was 64 years old, recently retired from his job as an accountant in Raffles Place. He told me, with tears in his eyes actually, that he hadn't been able to perform for almost a year, and he was convinced his wife would leave him. He felt like his life was over. I talked to Mr. Tan for a long time. We discussed medical options, yes, but more importantly, we discussed communication with his wife. I encouraged him to be honest with her about his feelings and fears. You know what happened? His wife told him that she didn't care so much about the erection. What she missed was the intimacy, the closeness, the feeling of being desired. Mr. Tan started on medication, which helped somewhat. But more importantly, he and his wife explored other forms of intimacy. They spent more time kissing, touching, and focusing on each other's pleasure without the pressure of penetration. 6 months later, when Mr. Tan came back for a follow-up, he looked like a different person. He was smiling, relaxed, and he told me that his marriage was actually better than it had been in years. This is not unusual. I've seen this pattern many times in my practice. Sometimes what seems like a problem can actually lead to something better if you approach it with the right mindset. Now, I want to address something specific. Some of you might be feeling like it's too late for you. Maybe you're 60, 65, 70, or even older. Maybe you've been dealing with this for a while and you've convinced yourself that your sex life is completely over. Let me tell you clearly, that's not true. I've been practicing medicine for over 20 years and I've treated men in their 80s who are still sexually active. Age might change things, yes, but it doesn't mean everything stops. With the right treatment, the right approach, and good communication with your partner, you can continue to have a fulfilling, intimate life at any age. Think about our Singapore pioneers. Many of them are in their 70s and 80s, still going strong, still enjoying life. Why should your intimate life be any different? The key is to not give up and to seek proper help. If you're experiencing erectile difficulties regularly, please don't be shy to see a doctor. You can see a GP first, or you can go directly to a urologist or men's health specialist. In Singapore, we have excellent medical care available. Many clinics, including mine, see patients with this issue every day. It's completely normal, completely treatable, and nothing to be embarrassed about. And here's another important point. Don't suffer in silence. Talk to your friends also. You'd be surprised how many men are dealing with the same thing. When I meet up with my male friends for coffee at the kopitiam, sometimes after a few cups of kopi, they start opening up about these issues. Creating a support network, even if it's just one or two close friends you can talk to honestly, can make a huge difference. Your partner is your best ally in this. Many men are afraid to talk to their wives or girlfriends about this problem because they think she'll be disappointed or leave them. But in my experience, most women are understanding and supportive if you're honest with them. They want to help you, not judge you. When you talk to your partner, don't make it a big dramatic conversation lah. Keep it simple and honest. You can say something like, I've been having some difficulties lately and I want us to work on this together. Can we try some different things? Most partners will appreciate your honesty and willingness to work on the relationship. Remember, sex is not just about physical acts, it's about connection, intimacy, and sharing pleasure together. Some of the best intimate moments don't involve penetration at all. Holding each other, kissing deeply, gentle caresses, all of these create closeness and satisfaction. Let me also mention something important about your overall health. Often, erectile difficulties are actually an early warning sign of other health problems, especially heart disease. The blood vessels in your penis are smaller than those around your heart, so problems with blood flow often show up there first. That's why if you're having persistent difficulties, you should see a doctor, not just for your sex life, but for your overall health checkup. As Singaporean men, especially those of us who've done NS and been through all that training, we're taught to be strong, to push through problems, to never show weakness. But when it comes to health issues like this, that mentality can actually harm us. Being strong doesn't mean suffering alone. Being strong means having the courage to seek help and to work on solving the problem. I've been treating patients for over 20 years now, and I can tell you with confidence that most cases of erectile dysfunction can be improved or completely resolved with the right treatment. But you have to take that first step to get help. So let me summarize what I want you to take away from this video. First, understand that your masculinity and your worth as a man are not defined by your erectile function. You are so much more than that. Second, if you experience difficulties, stay calm, don't panic, don't force it. Create a relaxed atmosphere instead. Third, explore alternative forms of intimacy. Oral sex, manual stimulation, kissing, touching. There are many ways to share pleasure with your partner. Fourth, communicate honestly with your partner. Use humor if it helps, but be open about what you're experiencing. Fifth, seek medical help if the problem persists. There are many effective treatments available regardless of your age. Sixth, never think it's too late. I've seen men in their 70s and 80s successfully treated and enjoying satisfying, intimate lives. And finally, remember that you're not alone. Millions of men around the world, including many right here in Singapore, are dealing with or have dealt with this issue. It's not something to be ashamed of. I hope this video has been helpful for you. If you found it useful, please share it with someone who might benefit from it. Sometimes the best gift you can give a friend is information that could improve their life. Don't forget to subscribe to my channel for more videos about health, wellness, and living your best life at any age. I'm Dr. Vanessa Goh, and I'm here to support you on your journey to better health and happiness. Remember, it's never too late to seek help, to make improvements, and to enjoy a fulfilling life. Take care, and I'll see you in the next video.